Welcome to Thursday's edition of COVID-19. The daily tally continues its roller coaster ride of ups and slight downs as we mark close to 700 new infections today. Meanwhile, vaccination efforts are facing several hurdles given safety concerns and supply shortages. We have details lined up next. Now, here first is the pandemic updates. So let's start here in Korea then for this Thursday.
Sunny, we are seeing a slight drop in infections this Thursday from a day ago, but we are just 2 cases short of 700, so not a big change there. And domestic transmission stood at 670 this Thursday with 28 cases from abroad. And that raises the total number of COVID-19 cases in the country to 112,117 with a total of 1,788 fatalities. And with the average, we now have infections now between the 500s and the 700s. And with that, the daily average in domestic infections in the past week stands at 624.6. So almost no change from yesterday.
I see. And in recent days, so I understand quite a number of infections are being confirmed at temporary testing centers.
That's correct, Sunny. In the past week, makeshift screening centers in the metropolitan region detected triple-digit figures of infections almost every day. And this comes on the back of extended testing at such testing venues, especially to find silent spreaders, with over a quarter of the recent cases being untraceable infections. As of 12 a.m. Thursday, 134 patients were confirmed through testings at makeshift centers in a day, which is 20% of all domestic transmissions recorded this Thursday, and almost 30% of 454 infections in the capital region, and which includes 217 cases in Seoul, 224 in Gyeonggi-do province, and 17 in Incheon. Now, beginning this Thursday, a government task force is carrying out special inspections across the nation at high-risk facilities such as cram schools, nightlife entertainment venues, as well as daycare centers to check if they are violating any prevention guidelines. And let's get an update on the vaccination front. We've had more than 45,500 people who received a shot on Wednesday. And meanwhile, staying on that vaccination front, the head of the World Trade Organization, Ngozi Okonjo-Iweala, on Wednesday called on action by countries and vaccine makers to increase production for a more fair and also more wider distribution, and also reduce export restrictions. And that, as we are seeing vaccination process around the world, but the figures are still rising. In fact, over 815,000 infections were recorded in just a day, and that raises the total to 138.8 million. A very serious situation in India, meanwhile, which hit 14 million cases in total, and also Turkey has hit a milestone, hitting 4 million cases in total. Let's take a closer look at some of the resurgences here. India, almost 200,000 infections reported in the span of 24 hours. And also Turkey, as I mentioned, is seeing an increase. Meanwhile, here in Japan, the figure itself is not as high compared to other countries, but only around 3 months left until the Tokyo Olympics. Tokyo is seeing around 500 cases a day, but Osaka is seeing more than 1,000 cases these days. So serious situation there as well. And I will be back with more updates after the government briefing. Sunny?
All right, so thank you for now. Right, back on the local front, concerns are mounting over the possibility of a 4th wave, even as authorities here have yet to contain the current 3rd wave that began late last year. Now, for more on this, I have Yoon Jung-min here in the studio with me. Hello, Jung-min.
Hello, Sunny.
Now, there is talk, Jung-min, about tougher COVID-19 prevention measures here.
Sure, Sunny. So for now, health authorities say they will keep a close eye on the situation before it reaches a final decision. But the government is under growing pressure to take action as Korea is adding hundreds of COVID-19 cases on a daily basis as of late. We'll take a look here.
We will thoroughly review the situation as we go along this week and determine whether we need to tighten social distancing rules and impose further restrictions on operating hours for businesses.
Last week, the government announced a 3-week extension to the current distancing rules, with restaurants and cafes in the capital region allowed to stay open until 10 p.m. But the authorities hinted at tighter restrictions if the situation worsens, and such venues will have to close at 9 p.m. Over the last week, Korea reported a daily average of over 600 local infections. The cases were mostly concentrated in the capital area, which includes Seoul and the surrounding Gyeonggi-do province. Health authorities also expressed concern over the loose compliance to prevention rules, especially with the weather getting warmer and more people looking to enjoy outdoor activities. Well, health officials say for now they have enough hospital beds to accommodate 1,000 patients as well as 1,300 who are severely ill. But they added that they will try to secure more beds in case the situation worsens.
I see. Meanwhile, Changmin, how are authorities here responding to reports of blood clots following inoculations using Janssen's vaccines?
You're right, Sunny. So the government says that for now, they will maintain their stance on the Janssen vaccines. Well, this follows a U.S. FDA recommendation to suspend the use of Janssen's vaccine after rare and severe blood clots were reported in 6 cases. Korean health authorities added that it will continue to keep a watchful eye for any further developments regarding the issue.
In regards to the suspension of Janssen vaccine in the United States, our own stance remains unchanged for now. We'll continue to monitor the situation and review the safety of the vaccines along with the KDCA.
Well, so far, the Korean government has agreed with global drug makers to secure enough vaccines for some 79 million people. That includes AstraZeneca vaccines for 10 million, Pfizer for 13 million, Janssen for 6 million, Moderna for 20 million, and more. The government plans to import over 2.7 million additional doses from Janssen, Moderna, and Novavax by the end of June. But some pundits are worried that safety concerns and the resulting vaccination delays could make it difficult for Korea to achieve its goal of herd immunity by November. Also, there is no word yet on the shipment date for Moderna vaccines purchased by Korea. The company said it plans to deliver 100 million doses to the U.S. by the end of May and 100 million more by the end of July. But regarding its supply chain for other countries, it was established around 3 months later than the company's U.S. supply chain, so corresponding delays are expected.
I see. And speaking of vaccine shipments, I hear we received a fresh batch of the Pfizer product.
You're right, Sunny. So on Wednesday, South Korea received additional Pfizer vaccines doses, enough to inoculate around 125,000 people. Well, in total, the Korean government has an agreement with Pfizer to purchase 26 million doses, so we will be expecting more of them to come later. The Pfizer vaccines will be administered to people over the age of 75 and residents and staff at elderly care facilities. And starting as early as today, COVID-19 vaccine recipients will be issued a certificate through a mobile phone application. It would include information such as vaccine type as well as when and where the shot was given. The disclosure of personal information such as name, date of birth, and nationality are optional. Authorities say the certificate is only for domestic use and cannot be used as an overseas travel document.
All right, Changmin, as always, thank you very much for that coverage.
Thank you.
Right, up next, we're poised to join the regular briefing on the COVID-19 situation here on the local front for this Thursday. And as always, while we wait for it to start, here are a few reminders related to COVID-19 prevention efforts here in the country. Now, do remember that face masks are mandatory at all indoor public settings outside of one's home, and failure to adorn them will result in fines of 100,000 won. Similarly, those who violate the no eating regulation will be fined 100,000 won. Eating is only permitted at places of dining and drinking. Also, free COVID-19 testings are now also available at all community health centers across the country. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation in South Korea for April 15th, Thursday. As of today midnight, we have 670 new local infections and 28 new imported cases. The total caseload now stands at 112,117. Yesterday, we had more than 85,900 tests conducted, and at the makeshift testing centers in the metropolitan area, we carried out 40,192 tests, confirming 134 confirmed patients. And we have 530 more people being discharged, while 7,816 still remain in quarantine. We have 99 patients with critical or severe conditions, which is a drop by 1 from the yesterday, and we have 6 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the recent major local clusters, please refer to the press kits, and we have some analysis on the preemptive tests carried out at virus vulnerable facilities. On a regular basis, we have been carrying out our regular testings for about 400,000 people who are users or working at the virus-prone facilities, and we have carried out these tests on a regular basis, and we confirmed 148 confirmed cases with an infection rate of about 0.003%. And we have seen that we have about 170 facilities that have shown these confirmed cases, and about 60%, at about 20% were asymptomatic patients, and also about 80% of them had symptoms. And we also have confirmed 940 additional patients that have been confirmed. However, at about 700 more facilities, we had no further local transmissions. To this end, we have been able to contain the virus to a large extent by detecting the first patients in an early manner, and also at the institutions that have been recommending these preemptive testings, and also comparison with those facilities that have been mandatory to carry out these massive preemptive testings. We have seen that there has been a significant decline in the amount of infection as well as fatalities in these facilities after they have been mandatory to carry out these testings. We have been able to note that there has been a significant decrease in these infections. However, there has been also many people who have been infected after our preemptive measures. So we ask for you to also monitor your conditions on a regular basis. And here we have some updates on our clinical trials and R&D. And the remdesivir drug has been administered to about 5,000 patients here in South Korea, and the Rekinora treatment has been also administered to about 1,530 patients here in South Korea as well. And vaccine development here in South Korea, we have 5 companies that have been approved of these clinical trials, and they are carrying out the clinical trials on 8 substances. And as for the SK Biosciences vaccines, as for the and the U Biologics vaccines, we have been conducting the first phase clinical trials as well. And we also have the DNA vaccine and the virus vaccines, which are also developed by other 2 bio companies, which are also undergoing clinical trials as well. And we have the virus bank, which is carrying out our virus cultivation here in South Korea. And we have been looking at the new variants that has been classified as the U.S. California variants. And also we have been starting our variants studies on the U.S. New York variant and also the Nigeria variant as well. And we will also begin our in-depth research for these new variants. And also as for the antibody treatment, we also have some analysis on our effectiveness, and we have seen that for the UK and the South African variants, we have been revealing the effectiveness against these new variants. However, those variants that have been classified as other variants under the U.S. California variants, the 2 types, we have been looking looking at these virus cells, and we have concluded that these treatments had effectiveness. And also, as for the Brazil variant, the key 2 variant, we also have seen that the treatment has developed the neutralizing antibodies. However, the P1 variant, which is the major strain of the Brazilian variant, we have seen we will be undergoing these effective testings going further. And as for the U.S. New York variant and also the Nigeria variants, these other variants will also be subject to these similar effectiveness analyses to see the effectiveness of these antibody treatments. And in order to contain the further new variants that are spreading globally, we will be also speeding up our development and research on the antibody treatments here in South Korea. And next, as for the life quarantine measures, that is, we have the safety e-report that is run by the Safety Ministry, and here are some breaches of quarantine measures. Lately, we have seen the self-cafes, self-study cafes, and camera studios, as well as self-laundry rooms. These types of facilities also have been prone to some breaches of the quarantine measures. And as for the self-laundry room, they had also weak compliance to the entry log, and people did not wear face masks on a regular basis and properly. And also at self-study cafes, people did not keep social distancing measures. And also at these self-camera studios, people did not comply with these quarantine measures, and they did not have proper ventilation as well. And as for these on-demand facilities, we highlight the importance of a voluntary compliance to the quarantine measures. So we ask the managers and the owners of these facilities to have a written notice on the walls that cite that people who are using these facilities need to mandatorily comply with these quarantine measures, including the wearing a face mask and also keeping social distancing. And we believe that the prolonged measures of the quarantine antivirus measures, we believe that there are some people who are becoming complacent against these measures. However, we have the joint pan-government task force team, and starting from today, we will be looking across all 17 cities and provinces to look at the virus vulnerable facilities to see whether they have any breaches of these measures. And next, as for the status on COVID-19 vaccinations, we first would like to reveal some great news about the opening of the vaccination centers. And today, we will be opening newly 104 vaccination centers across the country. And starting in the past few weeks, we have been able to have the vaccination rollout for about 30,000 on a daily basis. However, we will be able to speed this up by more than twofold to have more than 70,000 people get vaccinated as well, utilizing these more increased numbers of the vaccination centers across the country. And moreover, here is the status on the COVID-19 vaccines. As of April 15th midnight, we have the 45,520 more people receiving their first dose of the vaccines, with the total number standing at 1,285,909, and a total of 60,569 people received their second dose of vaccines. And among those eligible for the first Q recipients, we have completed over 80% of the vaccinations, and by nursing hospitals, we have completed 89% of the vaccinations, care facilities about 85%, and the first responders, we have 84.4%, and also General Hospital, we have 85.6% of the vaccination rate. And at the COVID-19 treatment hospitals, which is rolling out the second doses, we have seen 98.1% has completed their first round of the vaccines, and a total of 93% of them have completed the second dose administration. And also, we have seen that the vaccination rate stands at about 13% for those eligible for the second Q. And starting from April 1st, we have been rolling out the vaccines to senior citizens above the age of 75, and their vaccination rate stands about 6.5%. And also the nursing hospital residents, we have been also carried out the vaccination for about 30% 41%. And also starting from late March, we have been also carrying out the vaccinations for the residents and the workers at the nursing hospitals, which stand at about 64% and about 54% for the workers there, respectively. And as for the post-inoculation adverse responses, we have one additional case of the suspected cases of anaphylaxis and one additional case of the suspected cases of severe cases, and 2 additional cases of death have been reported, with a total now standing at 51. And last but not least, globally, we are seeing the global surge of the COVID-19, and on a weekly basis, we have seen a 7-week increase of the global tally, and we are seeing a major resurgence of the virus internationally. We are also seeing countries that have been speeding up the vaccines, and despite their vaccine rollout, they are also struggling with an increase of the infection rate due to the ease of social distancing measures and lockdown measures. And as for the U.S., the similar measures are also symptoms or phenomena are also being witnessed, and the same is for Japan as well. And in Germany, the UK variant is increasing at a steady pace, and they are continuing to have an intensive lockdown across the country. And as for countries in the Southeast Asia, and also in the Middle East, and also in other regions, Pacific regions as well, in the Philippines, India, as for these countries, they are also having new record high daily tallies for the COVID-19 infections as well. And France also carried out a nationwide lockdown as well, and Turkey also carried out an intensive lockdown under the Ramadan period. And here in South Korea, we are seeing a daily tally hovering over 600, and we are seeing a rapid surge of the virus nationwide. Nevertheless, we are seeing a decrease in the number of patients with critical or severe conditions, and we are also seeing decrease in the fatality rate. And we believe that this is very fortunate, and we believe that this was possible thanks to the preemptive testings that were carried out at the virus vulnerable facilities, and also the vaccination rollout at the nursing hospitals and nursing homes. And also this is due to the expertise and the dedication put forth by the medical professionals, as well as the effectiveness of our treatments that have been developed. The ultimate goal of our quarantine measures that are being rolled out here in South Korea is to minimize the size of our damage, and this is all about decreasing the rate of the fatalities and also the number of fatalities. And this is why we have prioritized the senior citizens when it comes to the vaccine rollout. And we have seen many countries that have rolled out the vaccines even before Korea. However, centering around the senior citizens, they had to pay a very heavy death toll. And as for the U.S., they had over 600,000 people who have also lost their lives due to the COVID-19, and the same also goes for UK and other countries as well. It is very difficult for us to eradicate COVID-19 immediately. However, we can decrease and minimize the size of damage. And as for South Korea, we have been carrying out the vaccinations for those senior citizens, and also if we do so for those with underlying medical conditions, we believe that this can help us to achieve herd immunity and also minimize the possible damages caused by the COVID-19 pandemic. And right now, among those over the age of 65, we have some people who did not receive their vaccines, and also their families or acquaintances. We ask you to comply stringently with the quarantine measures. Moreover, we ask all of the public to also take particular precautions if you are living with these senior citizens, and also until the day we reach our herd immunity centering around these senior citizens and those with medical conditions, we ask you to contain the virus and participate in the quarantine measures. And we ask for your continued efforts going forward, and we will also exert our full efforts to this end. Thank you very much.
Right, there was Kwon Junuk with Thursday's afternoon briefing. So what did he have to say?
Let's begin with an analysis on preliminary COVID-19 tests that were conducted over the span of around 3 months until March 18th at high-risk facilities. Some 400,000 people were subject to these tests, and 148 cases were confirmed through these early testings. And also there were some words on antibody treatment studies on variant cases. And Kwon mentioned that the U.S. California variant, the antibody treatment seemed to be effective on the U.S. California variant, although that's not a very frequent case that has been confirmed here in Korea. But earlier already, we know that the South African variant and the UK variant, the treatment also worked on those, but there's still more analysis needed for the Brazilian variant. Also, some good news, 104 new COVID-19 vaccination centers will open, he said, across the nation. So that is predicted to enable around 70,000 vaccinations a day, which would be around double the amount that we are seeing right now. So the official stressed that this will make the inoculation process for seniors especially more faster. And one more thing where people should be cautious about is places such as self-laundry, self-study cafes, and self-camera studios. So you would believe that those could be safer because you're doing all these activities alone, but it has been found that violations of social measure distancing were found there, such as not wearing masks properly.
Oh, I see. All right, so thank you for that.
My pleasure.
Right, many workers across the world transitioned to teleworking amid the onset of COVID-19 last year. In this report, we delve into these remote working arrangements and explore the possibility of a permanent shift in the traditional work structure post-pandemic. Do take a look.
Remote working has settled in as the norm, with the pandemic showing little signs of drawing to a close. Although it varies by sector and occupation type, teleworking has now become the most dominant form of employment in many parts of the globe. According to a recent survey of Korea's 100 largest firms by revenue, over 90% said they had adopted work-from-home policies. Remote working has received a warm reception for the most part from Korean workers. Workers cite the hours saved and the hassles avoided on daily commutes and more free time as the main perks of remote working.
카메라만 켜면 되고 간단한 준비해서 그래서 이 출퇴근의 어려움, 시간 전략, 또 불편함 해소 이런 게 첫 번째 이유라고 생각이 들고요. 두 번째로는 아마 오히려 혼자 근무에 집중할 수 있는 집중도 향상에 긍정적인 면이 있지 않았나 생각을 합니다. 물리적으로 떨어져 있으면 필요한 경우에만 온라인을 회의를 하고 하는 이런 그 집중도, 효율성 제고의 측면이 더 크기 때문에 어느 정도는 활성화되지 않을까 그렇게 생각을 합니다.
With the adoption of teleworking, many other functions like company dinners and workshops have also gone virtual as well. This emerging trend has opened up a new market for event planners specialized in arranging virtual events.
일단 가장 많은 반응은 이 온라인으로 이게 가능해? 약간 이런 반응이에요. 그리고 대체적으로 거의 90% 반응이 생각보다 재밌는데 약간 이런 느낌인 것 같아요. 작년 12월 달에 연말 기업 행사를 취소한 게 한 90% 정도 된다고 하더라고요. 근데 그 90% 중에서 25%는 이제 비대면 송년회로 진행을 했었는데 요즘에는 모든 기업에서 행사를 진행할 때 거의 비대면으로 거의 100% 진행하고 있는 것 같아요.
The shift towards remote working is also accelerating in countries abroad. Many physical office spaces have been left unoccupied and deserted amid this growing trend. This phenomenon is being witnessed in a number of major cities across the world, including New York City, home to the most office space of any metropolis in the United States.
Today, as we speak, less than 1 in 5 office workers are using the office. And because of that, we have a lot of vacancy in offices, and with little interest among tenants, we are seeing that rents are now dropping as a result. Owners of buildings are looking to entice tenants by lowering the rent, by offering other concessions to really get them to come in and view space and to lease long term.
However, not everyone is enjoying the experience of working from home, with some workers complaining of feeling socially isolated and a confusing blur between work and family life. As such, there are several pitfalls that need to be addressed in order for teleworking to settle in as the accepted norm.
우리나라 일부 기업들의 경우에는 관리자들의 비대면 업무 방식에 대한 인식이 좀 낮은 경우도 있고요. 또 비대면 업무 진행을 위한 시스템 구축이 미비한 경우도 있고, 또 근로자들 간의 의사소통 방식 경험 부족 등으로 인해서 재택근무 방식에 어려움을 겪고 있는 기업들도 일부 있는 것으로 알고 있습니다. 가장 먼저는 관리자의 역할이 중요합니다. 관리자의 생각이 바뀌어야 되는데요. 왜냐하면 일하는 방식이 바뀌기 위해서는 일을 시키는 방식도 변해야 합니다. 따라서 재택근무가 정착되기 위해서는 직무관리나 평가관리 같은 인사관리 시스템이 뒷받침될 필요가 있습니다.
Teleworking has brought indelible changes to the way we work, and by extension, a paradigm shift in the fundamental way that businesses operate.
이달부터 노바백스 백신의 국내 생산이 시작되고 상반기 백신 생산에 필요한 원부자재도 확보했습니다. 6월부터 완제품이 출시되고 3분기까지 2천만 회분이 우리 국민들을 위해 공급될 예정입니다.
The task of procuring COVID-19 vaccines is becoming increasingly difficult amid supply shortages and safety scares with regard to some products. For more on ways to address this reality and others, I have Dr. Arirang Tan from Miss Mary Women's Hospital. Welcome back, Dr. Tan.
Good afternoon.
And I also have Dr. Anne Wartel at the International Vaccine Institute joining our talk virtually. Good to see you again, Dr. Wartel.
Good afternoon.
Dr. Wartel, let's begin then with your thoughts on the growing visibility of vaccine inequality across the globe.
Well, I think it's a worrisome situation now, what we are witnessing. Ensuring widespread global access to COVID-19 is necessary and crucial, as we do know, for preventing deaths and cases and contributing to the global population immunity. Despite enormous efforts that have been put in place with the COVAX facility aiming to support the development and delivery of 2 billion doses by the end of the year, with a particular focus on low and middle income countries, unfortunately, we see that there's still disparity. Although some low and middle income countries have received the first doses of the authorized vaccine. When you look at the high income countries, they represent just a fifth of the global adult population, and they have purchased more than half of all vaccine doses, resulting in disparities between adult population share and doses purchased from the countries. And I would even say that the disparity is even more pronounced when looking at the share who could be vaccinated. While enough vaccine doses have been purchased to cover more than 80% of the adult population, high-income countries own enough doses to vaccinate more than twice their population, while in low and middle-income countries, they can only cover 1/3. And let me add additional things and thoughts on this. Providing all COVAX doses to low and middle-income countries could help, but would still leave vaccines out of reach for most of the global population. And you can see that the disparity between vaccine purchase and country income level is significant, but could be addressed in large part through what is called redistribution of doses, as some high-income countries have said they would do so. So I would say we should close the gap as soon as possible, to not allow the coronavirus to continue circulating in poorer countries and prolong the pandemic that we all have been suffering for a year now. So remember, no one is safe until everyone is safe.
Right, of course, Dr. Wartel. And against the backdrop set by Dr. Wartel, Dr. Dan, let's touch upon the vaccine procurement efforts here on the local front. How many doses has Korea secured so far, and what is your assessment of Korea's efforts to this end?
Well, I'd like to say, first of all, that Koreans should feel proud about our country's involvement in the COVAX AMC. We were one of the first signatory countries to sign on to COVAX, and that really signals our commitment to global equity of COVID-19 vaccines. We've also been very aggressive in our procurement efforts. We have under contract enough vaccine to vaccinate 79 million people. However, of course, supply and demand issues have resulted in only, I think, 3.6 million doses arriving in our country during the first quarter. That's enough to vaccinate about 3.5% of our population. In addition to procurement, though, I think we also have an issue with the pace of vaccinations. Right now, I mean, in our country, we have enough Pfizer vaccine to vaccinate fully more than 600,000 people with the Pfizer vaccine, and they could be fully vaccinated by the first week of May if we picked up the pace. That's all we need to do. But unfortunately, that's been an issue, and Monday, Tuesday this week, less than 30 people were getting their second dose of the Pfizer vaccine, and that's really, I think, an unacceptable pace. Encouraging news, however, is that we had very high uptake of the vaccines of all eligible people during the first quarter. About 95% of people who are eligible to receive the vaccine did receive either the first or second shot. And that's actually very good news. If we keep up with this pace of uptake, I think we will be on track once the vaccines do arrive to reach herd immunity by the end of this year. We've also been successful in overcoming some raw material sourcing obstacles so that now we can start manufacturing of the Novavax vaccine in our country, and hopefully this will lead to supply of 20 million doses of the Novavax vaccine sometime in the June-July timeframe.
Right, and hopefully our vaccination pace will pick up. I mean, Kwon spoke about having more centers open starting this week. Dr. Wartel, Janssen's vaccines have been linked to reports of blood clots over in the US. Are these cases similar to those linked to AstraZeneca vaccines?
So since AstraZeneca vaccine introduction, rare clotting problems have occurred due to venous thrombosis or, arterial obstruction leading to death. For instance, when you look at the AstraZeneca vaccine and the volume, for instance, 20 million doses have been administered in the UK. There were 79 cases that had occurred after the first dose within 4 days. And among the 19 deaths that were recorded there in the UK, 13 were women, and the cases were observed between 19 to 50 years of age, leading thus to the decision of many countries to limit the AstraZeneca vaccine to older population or older people. So it appears that the vaccination with AstraZeneca can result in the rare development of autoimmune disease that is called thrombotic thrombocytopenia. When you look at AstraZeneca product and the frequency of the event, it was between 0.2 and 1 over 100,000 recipients. And when you put that into the perspective of other products, and I'm thinking of penicillin anaphylaxis shock, for this event, it is observed in 20 to 40 people that have received among the 100,000 recipients that have received antibiotics. So just to give you a bit of perspective of that, because when it comes to vaccination, the risk notion is very important. And we need to still look into the benefit-risk ratio that is still favorable to the vaccine to prevent the severe form of the disease and also to prevent the ICU admission due to COVID-19. Now, for Johnson & Johnson product, we just learned 2 days ago that there are extremely rare cases of unusual blood clots in combination with low platelet count as well in a very small number of people. And the US FDA and CDC actually have paused the vaccination with the Johnson & Johnson vaccine in the US to further look into these 6 cases that were reported, out of the 6.8 million doses that have been given with the Johnson & Johnson product. And at the same time, I understand that the company has also made the decision to proactively delay the rollout of the vaccine in Europe and also pause the vaccinations of all the subjects in their clinical trials. And lastly, I would say that EMA in Europe is also looking into this safety issue. And then they should be issuing some recommendation next week or so.
Right.
So to me, it may be too premature to draw a conclusion on the class effect with the adenovirus platform used in both vaccines. And I would say what is reassuring to me, though, is that the pharmacovigilance system and the safety monitoring system in the countries where the vaccines are being deployed it works very well, and the vaccine safety monitoring is still ongoing to help us detect the rare and very rare events.
Right. And keeping in mind what Dr. Wartel has just said, Dr. Dan, how do safety concerns first over Janssen's vaccines look to affect Korea's inoculation drive, do you think?
Well, I'd just like to say, first of all, as was mentioned, the FDA and the CDC, they have just recommended a pause of their vaccine. It's not a complete stoppage or a recall of the Johnson & Johnson vaccine. And so I think what will likely happen is similar to what we did for the AstraZeneca vaccine. We will have to do perhaps a risk-benefit analysis based on demographics and just determine, in other words, match the vaccine to the demographic population so that we can optimize benefit and minimize risk. And I think that's what eventually will happen. And I think that's why we procured, so much vaccine up front, because we anticipated that there would be safety or quality or technical issues along the way. And so we needed to cover our bases from the beginning.
Right. Meanwhile, Dr. Wartel, authorities here have yet to grant the green light to another COVID-19 vaccine. We're talking about Novavax now. Having said that, what can you tell us about this particular product compared to its peers?
Yes, so the vaccines that have been used so far are based on mRNA or viral vector or wholly inactivated vaccine platforms. So for Novavax, it is the first, I would say, one that is based on a different platform. That is called a recombinant protein-based vaccine using an adjuvant as well. So this vaccine is given in 2-dose regimen. And the clinical studies have shown that the overall vaccine efficacy is about 90%, 85% in the UK study and 60% in the South Africa study. So the vaccine has to be stored within 2 to 8 degrees Celsius. And its vaccine presentation is interesting because it's a readily to use liquid formulation, which is to me a great asset for a national immunization program because you don't need to reconstitute the vaccine. And lastly, I would say this vaccine is a protein-based vaccine that is known to provide a long-lasting immune response. That still needs to be shown, of course.
I see. And staying with Novavax, Dr. Tan, I hear a technology transfer deal between SK Bioscience and Novavax will come with greater benefits for Korea. Could you elaborate?
Right. Well, not only will the technology transfer benefit Korea and also India is the other country that received the transfer, but, ultimately the world will benefit because of the increased supply of high quality vaccines. The role of technology transfer is considered a global strategic imperative to try to get enough vaccine supply to overcome the pandemic. According to Novavax, SK Bioscience has licensed now to manufacture and commercialize a Novavax vaccine for sale to the Korean government. And the technology transfer agreement relates to manufacturing of the Novavax antigen, the protein antigen, also supply of the MTM adjuvant, and support of the company, SK Bioscience, in their bid to get regulatory approval of the vaccine later on. Hopefully, this technology transfer agreement will also lead to, as I said, the successful delivery of the 20 million doses of Novavax vaccine at the earliest June, but sometime in the third quarter of this year.
Right. Meanwhile, Dr. Wartel, I understand there are alternatives to the injectable COVID-19 vaccine that are being experimented right now. What do you suppose are the merits of such alternatives?
So as far as I know, there are, I think, 6 or 8 new vaccines that may be ready for review by the end of the year by the regulators, some of which don't require needles and can be stored at room temperature. So to me, this type of vaccine is aimed at improving the delivery system, if you will, including oral and nasal administration and skin patch. So such method are better suited to some people, like pregnant women, for instance, or those that are afraid of injection or shot. Furthermore, I would say the features of these new inoculations or vaccines would provide advantages, for instance, in terms of logistics, in terms of transportation, and in terms of cold chain management.
Right. Meanwhile, Dr. Dan, clinical trials are underway here in the country for vaccine candidates developed by 5 Korean firms. How do you assess these efforts here on the home front?
Well, as you said, 5 Korean firms. They are SK Bioscience, Celid, U Biologics, Genexine, and Gene1 Life Science. Hopefully, we will be able to build on our experience of delivery and manufacturing, administration of the international vaccines, so that once our domestic vaccines reach approval, that we will be able to have a good rollout of these vaccines. Looking ahead, having this experience and having this technology under our belt, so to speak, will be so important, not just for COVID-19, but the next pandemic that is for sure going to hit, our world, our country at some time. And so we do need, as the government officials have said, we do need to make sure that these trials are carried out till the end, till the very end, and we do not give up on them. In terms of logistics and supply, of course, there will be an advantage, but I think there might also be a scientific advantage to having a homegrown and home-tested vaccine. The reason why I say this is because the phase 3 trials for the other vaccines that are currently approved, AstraZeneca, Pfizer, Moderna, they only had a very small minority of ethnic Asians in their trials. And with the Johnson & Johnson vaccine, it was noted that all 6 of the people who got the CVST with the low platelets, they were all white. They also noted that there were no cases of CVST and low platelets out of South Africa. So there might be an ethnic relationship to vaccine efficacy and also side effect profiles. And so we would like to know, what a homegrown, home-tested vaccine will show in phase 3 trials, and that might give us more confidence when we deploy it eventually domestically.
Of course. All right, Dr. Dan, as always, thank you very much for your thoughts. And Dr. Wartel, thank you very much for being with us today.
Thank you.
Right, now, equally as important as the pace of public inoculations is the safety of our COVID-19 vaccines. Join us at this hour for more related coverage. Thank you for watching.